stuck in our minds. We get stuck in our daily thoughts, and when we wake up, we're either in a good mood or a bad mood, or we're stressed or worried about everything that we have to do. The amazing thing about our minds is that if we train our mind, we can wake up every day in a positive mood and reduce stress. I'm Pamela D. Wilson. Stay with me for the caregiving chat of the day. My website is pameladwilson.com. On there, you'll find helpful information for caregivers and care receivers. I had a long conversation yesterday with a person who is diagnosed with diabetes. I was interested in learning how this person managed the diagnosis, what the costs were, and how the disease was managed. And I'm going to share this with you because it's very interesting. And it just proves that we have, as individuals, as caregivers, as care receivers, we have so much control over our daily lives and our minds and the choices that we make, more than we even know. But until you realize it, you may not be able to put this into effect. First of all, if you have a health diagnosis, what are you doing about it? Are you becoming more educated? Are you seeking out education? Or are you expecting that healthcare system, those doctors, the nurses, to come to you? Are you expecting people just to bring everything to you that you need to know? I will tell you that doesn't happen. In this video post, there is a link to a radio show that I did about patient engagement. And I actually, on that show, interviewed a doctor about diabetes. So my conversation yesterday and that show tied together for this video. As individuals, caregivers, people who need care, we have to be that person who seeks education, who seeks information, if we want to be less stressed, if we want to have better health, if we want to worry less about things. With any health situation, there are the hard costs. We have health insurance, we have co-pays, premiums, medical tests, all of those things that we have to worry about. There's trade-offs. If you have health issues, any area, usually a good diet and exercise are good things to do. If we look at ourselves, how many times do we drive through a fast food restaurant or not make a good choice? The trade-off is I can buy fast food and spend $10 on something, or I can go to the grocery store and spend $10 and get a lot of good food here that I can eat. Food that I can take for lunch, food that I can have for dinner and breakfast that is much better than that fast food that I ate. Not that we don't want fast food every now and then, we can do it, but there are trade-offs when we have health issues about the easy path and the better path. Then, if you are diagnosed with a health issue, we have this thinking of what did I do to cause it? How did I cause it? And then there is the time to figure out what to do about it. That time is taking off work to go to doctor appointments. Maybe if you're going to school, you have to arrange your doctor appointments around school to go see the doctor. Personal time is involved in solving our health issues. Doctor appointments, medical tests, and I'll go back to the education component. For many of the diseases that exist, heart disease, arthritis, strokes, there are associations. The American Diabetes Association, the American Heart Association, the Stroke Association, the Alzheimer's Association. All of these associations exist to provide education to consumers. Depending on where you go see your doctor, if it's on a medical campus, they may also have education for you. My videos, the education on my website is also another important component because I give the patient side or the caregiver side of the story, not necessarily the healthcare side. Because I work with caregivers, I see what happens because I have been responsible for the care of people for more than 20 years. I have run into all of the roadblocks that you do every single day. Managing caregiving, managing our health, it's a choice that we make. It's the idea that we have to decide to get busy, to learn and be proactive and be educated. Because if we do that, we can avoid many of the after effects or the future effects of a diagnosis. And I'll talk about diabetes again. For people who have diabetes, many times they have vision issues, dental issues, foot issues, wound healing, more likely to have heart disease, more likely to have a stroke, more likely to have kidney disease. There are so many complications with diabetes that the doctors don't always tell you about. Where do you learn? You have to seek out the information. Information is on my website at PamelaDWilson.com. And I want to end this video with one of my favorite quotes that I thought about when I was talking to this person yesterday, who mentioned that a friend of hers who was an alcoholic had to make a choice between living or dying. And this person chose living. And they had been sober for 6 years. So it reminded me of a movie. I don't know if you've ever seen The Shawshank Redemption, but if you have not, it is a fabulous movie. You can check it out on YouTube, and I suggest Googling the statement from that movie, which is get busy living or get busy dying. We all have that choice every day when we wake up to choose if we are going to have a good day or a bad day, and choose whether we are going to take care of our own health, help an elderly parent take care of their health, and take care of ourselves as caregivers. Have a fabulous day today. I will see you again in another video. Please do share my website, PamelaDWilson.com, with everybody that you know, and check out my radio show every Wednesday night, The Caring Generation.